Good morning. Hi, everyone. I appreciate y'all coming out today. I'm Anna Maki. I work over here primarily on the benefits side. So, the benefits navigation program is one that I started back in 2016. We've served a lot of families since then. And it's been an interesting journey because Social Security's rules have changed over the years. So, I'm very excited to be able to connect with you today and go through the process of the basics of Social Security. Next slide. So, what do we want to do today? I think we'll do a lot if we can cover these basic areas. So, first, I want to make sure that you have an understanding of Social Security benefits. What's the difference between supplemental security income and Social Security disability insurance? Years ago, when I was applying for my son, I thought, my son has a disability. So, if he
So
has
if
a
he has a
disability, he
disability,
should
he should
have
have.
Social Security disability. That makes sense, right? But not always so much. So supplemental security income is generally the benefit that individuals apply for when they turn 18. So we're going to talk a lot more in detail, but I really want you to understand what those differences are between SSI and SSDI. And then we're going to talk about health insurance basics as well, because as adults, when adults are trying to be independent, what they're really needing is some form of income, some form of health insurance, and some level of services. So, Social Security is very much a gateway benefit because, especially SSI, starting with SSI, because SSI is tied to Medicaid and SSDI is tied to Medicare. So, it's going to be important to have some level of income as well as some level of health insurance. We're going to talk about the application process and what that looks like today. Might be changing again soon, but we'll talk about what that process looks like today. And then we'll focus on the medical determination of disability. And this is the key piece, and this is what I spend most of my time when I'm working with individuals. I want to make sure that they have the appropriate documentation to get that medical determination of disability. And we'll talk about the blue book with Social Security. So Social Security has a blue book that's all things tied to eligibility criteria for that medical determination. And then they have a red book, and the red book is all the rules about if you are a Social Security beneficiary, how do you work and maintain those benefits? So we'll talk about the blue book and the red book rules. So very excited to walk you through this process today. Next slide. So let's jump in with what is supplemental security income. So the core difference between supplemental security income and Social Security disability insurance is that this program is a needs-based program. And what that means is that when you apply, the first thing that's going to happen before they get to that medical determination of disability is an eligibility screen, a technical eligibility screen. And what Social Security is looking for is they're saying, are you financially eligible to participate in this program? So again, generally individuals are applying for SSI when they're turning 18. Prior to 18, the parent's income is going to be factored in because the individual's a minor. So if your annual household income is above the federal poverty line, you're probably not going to be eligible for SSI. So when individuals turn 18 and we're not looking at parents' income anymore, we're just looking at that individual's income. Most of the individuals aren't working and they never have been working. So they don't have that source of income. So there are income caps and there are resource caps. So that's what this means testing is. It's Social Security basically asking a lot of questions to figure out how much income does this 18-year-old have, right? And keep in mind that child support is going to count as income for that person. So that's always something to take under consideration. But they're looking at any form of income, and then they're going to look at any form of resources. And because Georgia is one of the states that when you're awarded SSI, you're automatically enrolled in Medicaid, What that means is when Social Security is doing that technical screen for SSI, that means they're also screening for Medicaid as well. So you can't have that more resources than $2,000. So the key difference about Social Security supplemental security income is that it's needs based. You do need to be aware of income limits and resource limits. If you're awarded, the maximum amount of SSI is going to be $914 per month. Generally, when individuals are awarded, there's going to be 1/3 taken off the top of that award. But we'll talk about that in just a little bit about how you can rebut that in-kind support and maintenance reduction. Next slide, please. This is a lovely slide because it kind of maps things out for you. So, yes, Medicaid is awarded concurrently with SSI because it's automatic enrollment state. We have mostly, I think, 31 states are automatic enrollment states. Um, Medicaid is not the end all be all though. It's a payer of last resort, but it's wonderful in catastrophic cases. When my son broke his foot we were looking at a $67,000 hospital bill. Medicaid swooped in and picked up everything that my private insurance didn't pick up. So that was awesome. But what's really essential about Medicaid as it relates to SSI, again, SSI is often viewed as that gateway benefit. It's because when we're looking at potential services down the road, you need to be Medicaid eligible in order to have a now comp waiver. Medicaid waivers are funded through Medicaid. So it's important to have access to Medicaid in order to be eligible for those now comp waivers. Again, you can't have any more resources than $2,000. So and this is why we have things like special needs trusts and ABLE accounts when you're thinking about the long-term life care planning over the individual's life, because they're always going to need to maintain that Medicaid eligibility. And that resource cap, $2,000, that hasn't changed in more than 30 years. And I don't see that it's going to change anytime soon. You can't even save up for a trip to Disney World, with more than with $2,000. So what do you do? So that's why for short-term saving, I would strongly recommend an ABLE account. For long-term planning, if your child is a beneficiary of your life insurance policy, if you make them a direct beneficiary, then you just have thrown your child off Medicaid, right? So you have the special needs trust as the beneficiary of that life insurance policy. So that's going to protect your eligibility for Medicaid. So Medicaid is really, really huge. So just wanted to make sure that you recognize the importance of Medicaid and look at that $2,000. This is one of the most common reasons why people will lose their SSI eligibility and get into an overpayment situation with Social Security is because they're not monitoring that bank account. And if that bank account has $2,001, then you have to give that Social Security monthly payment back to Social Security because you weren't eligible that month because you have to stay under that $2,000 threshold. So I can't emphasize that enough. SSI is needs based, so they're going to always be looking at resources. They're always going to be looking at income, and that resource cap is $2,000. Next slide, please. So if that's SSI, then what is SSDI? So SSDI is Social Security Disability Insurance. When you're working and you get your pay stub and you see all those deductions that were taken out of your gross pay, one of those deductions is FICA taxes. That's what's funding the Social Security Trust Fund. So SSDI is based on your work records. Whereas again, SSI is needs based. SSI is not funded through the Social Security Trust Fund. It's part of the general federal budget because it's more or less a welfare program. In contrast, SSDI as disability insurance, this is an entitlement program, meaning that because you have put all of this money into it, you are eligible for that money. So, what about our kids that aren't going to be working at this level? How do they benefit off of our work record? That's the key with SSDI. And this is what you see when parents retire, that their individual transitions from SSI to SSDI. But one of my most commonly asked questions is, what's the monthly award for SSDI? Because we know the maximum award at SSI is 914, right? So what is it for SSDI? And my answer is, I don't know, because it's going to be based on your work credits, right? So what we see sometimes is individuals who start with SSI but are working. Over time, as you're working, you're earning work credits, and that individual may be eligible for SSDI on their own work record after a period of time. And they're generally concurrent beneficiaries. So for a while, they're having both SSDI and both SSI. But then the most common model, and Bobby, if you would do the next slide, please. The most common model is when an individual is a childhood disability beneficiary and they're receiving Social Security benefits off of their parents' work record. So how does that happen? How that happens is the parent first has to be drawing Social Security, either because there's a survivor's benefit because the parent has passed away, or because the parent has retired. And when I say retired, I mean retired and drawing Social Security. Or the parent is disabled and drawing Social Security. So when you apply for Social Security, when you retire, they're going to ask, do you have an adult dependent child? And you say, well, yes, I do. And that allows Social Security to link those files. So that's really the process for an individual transitioning from SSI to SSDI. So you generally start with SSI when the individual turns 18. Then when the parent retires, they transition over to SSDI, getting 50% of that parent's work record. If that amount is less than the SSI award, then they're going to be concurrent, because we don't want to have people having less than a needs-based program under SSDI. So it is possible to have both SSDI and SSI. Next slide, please. So we talked about the importance of health insurance with SSI, that's automatic enrollment with Medicaid. With SSDI, if it's on the individual's work record, that's going to open the door to Medicare. But more commonly, it's when the parent is retiring or the parent has deceased that we're getting Social Security benefits, SSDI benefits, for that child, for the adult dependent child. And so there's a 24-month waiting period, like 2 years, before the individual is going to be receiving Medicare. So that's an important gap to plan for and to think about in terms of managing the healthcare insurance. So when an individual has SSI and Medicaid, and even if their SSDI income after the parent retires is higher than that, so they're not concurrent beneficiaries in the sense of getting two forms of income, the individual can still maintain their Medicaid, right? This is very key. They can still maintain their Medicaid as an adult dependent child under SSDI. There's over 30 different classifications of Medicaid in Georgia, and it's a very confusing process. And many of y'all are in the Medicaid renewal process right now, so we know how cumbersome that can be. But there is a specific policy that outlines the adult disability or adult dependent children classification for Medicaid. So that's just important to know and to be aware of, because sometimes mistakes happen. Sometimes I see a very seamless transition from SSI to SSDI. They're getting a higher level of income. We're in sort of that waiting period for Medicare, but their Medicaid is continued. But sometimes there's a boo-boo, and sometimes that Medicaid gets dropped. And in those instances, we want to be prepared to go back through the process. And instead of going to Social Security, we're going to go to DFACS to get that SSI, excuse me, to get the Medicaid reinstated as a childhood disability beneficiary. So childhood disability beneficiary, wonderful benefit for SSDI. Um, Once they're eligible for Medicare and they're receiving Medicare, there's costs to Medicare. So there's another form of Medicaid called QMB Medicaid. So I want you to be aware that when your individual has transitioned to SSDI, they've carried over their SSI because they're an adult dependent child, and they now have Medicare. They can apply for another form of Medicaid called Qualified Medicare Beneficiary Medicaid. The express purpose of this form of Medicaid is simply to pay for Medicare. So then that way, the costs of the Medicare B and all of that are not being taken out of the individual's SSDI income. So really critical benefit. I think what people aren't aware of is that 2-year waiting period though. So that's something that as you're doing your long-term planning, you want to be mindful. Okay, I'm retiring. My child's on SSI. Now that I'm receiving my retirement benefits, they're going to receive up to 50% of what I'm getting. So if I'm getting 3,000, they're going to get 1,500, which is higher than 914. So they're going to come off SSI onto SSDI, but I got to plan for those 2 years before they're going to be eligible for Medicare, right? Next slide, please. So just wanted to mention the deeming waiver. So I do have a number of individuals who are under the age of 18 who have access to Medicaid through the deeming waiver, also known as the Katie Beckett deeming waiver. And so this is a program whereby because of the individual's significant medical needs, they are eligible for Medicaid without view of the parent's income. In other words, we're waiving the requirement of income for these individuals. So when we have folks who are on the deeming waiver and they're transitioning at age 18, they need to apply for SSI. They're going to be eligible to continue access to Medicaid. There's what's called a transitional Medicaid that they're going to be eligible for until they receive the straight Medicaid from SSI. So just wanted to put that out there. What's going to be important if your individual is receiving the Katie Beckett deeming waiver, when you apply for SSI, you need to forward a copy of that application to the Katie Beckett Central Unit office so that they're aware that you've done your due diligence in filing for SSI, and that's going to prevent your individual losing access to Medicaid during that transition. Next slide, please. So how do you apply? Oh, this process has changed over the years. Pre-pandemic, I would go with my participants to the office and we would slide the documents under the plexiglass window. And there's a handful of individuals that are still going into the offices. As you know, during the pandemic, all the offices closed. And so Social Security moved to an online process. And so all the applications were done online. And what they hadn't anticipated was how many people were going to be applying for benefits online, because it's kind of a chilling effect to have you come into the office. I mean, none of us really want to spend hours at Social Security office, right? But going online to complete the application, pretty easy. So pretty much that incredible volume of Social Security applications almost broke the system. And you add to that, we're in a sort of a labor shortage situation. Social Security is at its lowest point of employees than it's ever been. And what this means is it's taking the process much, much longer. They have instituted some efforts to try to streamline that process a little bit. And so that's what happens when you go to the ssa.gov. What you do to get started is more like a two-step process now. To get started, you complete, takes you about 5 minutes. It's a basic identifying information online application that's going to request a phone interview to do the technical screen for SSI. If you have SSDI, there's no technical screen, but SSI, remember, it's means tested. They got to ask about income, they got to ask about resources. So it's got to be screened. So they're going to, you can, through that site, you can complete that 5 minute identifying information um, questionnaire, if you will, and during that time, you can then just click the button and you're going to receive an email that's basically confirming that you have completed this. And then you'll receive another email with a phone appointment. So it's important that you look for those emails, and they're going to give you a day and a time, and they're probably going to be late, but it's important that you can document the fact that you have that time, and if they don't show up, then you can say, okay, I have this email and this is when we were going to meet and I need to reschedule and what have you. So, but you do receive an email with that to have that phone interview. Um, then that's part one. Part two is they really want you to complete the online application. And the online application is based on the Adult Disability Report. That's SSA Form 3368. And it's basically what are the medical conditions. Section 8 is the medical information of where you list all the doctors and the first visit, the next scheduled visit, all of that good information is in that adult disability report. I really encourage you to print out the form 3368 and fill it out first and then go online to do the application, because when you're doing the online application, you can't forward through all the screens. You do one screen at a time, and if you can't complete the information, you have to save and exit. So if you have all the information from your adult disability report, it's going to be super easy to complete that online application. It's going to take you about a half hour to do that. The only two questions that are not on the adult disability report that are on the online application, you know these, is what city and state was your child born in? Sweet, we know that one. And the second is, does the individual have a bank account? Because they want to go ahead and get the banking information so they can do direct deposit once Social Security has been awarded. So how do you find that online application? You can Google Adult Disability Starter Kit. So if you go into your browser right now and Google Adult Disability Starter Kit, you're going to see a hyperlink for that online application, which is more or less a mirror of this Adult Disability Report Form 3368. Next slide, please. So the hard part of getting an award is getting through disability determination services. So basically what the process looks like when you're applying for SSI, you go in, you do the request for the phone interview, you do the online application, you've submitted that. They call for the phone interview. You do the technical screen. They're asking about the income. And there's no more income than the amount of the award, so they're good. There's no resources more than 2,000, so they're good. So you've cleared the technical screen. At that point, they're going to transition your application away from intake over to disability determination services. So disability determination services, their job is to determine whether or not you have a disability under Social Security criteria. In other words, they're looking at what is your primary disabling condition, and this is where that blue book is going to come into play. So we want to make sure that we're looking at the blue book to know what the criteria is for the medical documentation that's required. So when that application is at Disability Determination Services, they have all the information that they need in order to make a determination. It's also important to know that when you're applying for SSI, remember how I mentioned that SSDI is an entitlement program? So your SSI application is going to be screened for SSDI. And so you're going to get a very thin letter and you open it up and it's basically you've been denied. And you're like, oh my God. But then you look up in the upper left-hand corner, Social Security is always going to tell you what program they're referencing. So it's a denial, but you've been denied SSDI. And that's okay because you weren't really applying for SSDI, you're applying for SSI, but they have to screen it for SSDI. So do expect that denial letter from SSDI. And then you're going to expect to get kind of a fat pocket from Social Security, and you open that up and it's like more than, I guess it's about 15 pages. Wow. What's all that? It's the printed out copy of the application that you submitted. And you're like, wait, when I submitted it, I was able to complete a copy. Okay, I've got my copy. They're sending you another copy. Why? Because Social Security, in order to finalize your SSI application, it requires two things. It requires a wet signature. So on page 10 of that packet that you receive from Social Security in the mail, page 10 is going to have a line on it for the individual to sign, not you, your child that's the claimant is going to sign that. So that's part one. Part two, there is a medical release that you have to sign. And this is basically Social Security saying, we're trying to make this medical determination of disability, right? So you listed all these doctors in section 8 of that disability report. We're going to contact those doctors and request medical records. So you sign that release that allows them to connect with those doctors. Next slide, please. So this is where it takes a long time. There are some conditions, if you look in the blue book, you're going to see some conditions are listed as compassionate allowances. So if you have a condition like Lee's disease, all you have to show is the documentation of here's Lee's disease, and they're like, gotcha. We're going to process your application in 30 days or less. You can also ask for a quick determination based on the severity of the condition. So if I have somebody who's has a let's say autism spectrum disorder with accompanying intellectual impairment, I can request that quick determination based on the severity of that cognitive impairment. So it is possible to get a determination fairly quickly. Down syndrome is another condition. You show that genetic lab report that says trisomy 21, and they're going, it's not a compassionate allowance, but they more or less treat it like a compassionate allowance. So those cases are processed usually within 30 to 60 days. But if your case is not that clear cut, if you have a condition that doesn't have accompanying intellectual impairment or doesn't have accompanying limitations like I'm non-ambulatory, then it's likely going to take about 8 to 10 months for the adjudicators to make that determination. What makes this process also take a lot of time is it takes time to get the medical records from all the doctors. So one of the things that we really encourage is that if you gather the pertinent, relevant, germane medical documentation and you send that with that signed copy of the application, the one that requires a little signature, and the release, then you know that Disability Determination Services is going to have the key information that they need to make that determination. And if they have enough, then they can go ahead and make that decision. So how do you know what that criteria is? Again, you want to go to the blue book. So you can Google Social Security blue book, and then you can put in the primary disabling condition. So let's assume it's cerebral palsy. Well, cerebral palsy is a spectrum disorder. So you have individuals that have less impact and some individuals that have more severe impact. So because of that range, it's going to you're going to bear the burden of proof of the severity and impact of that condition. But you can at least get a jump on what eligibility criteria looks like through the blue book. Next slide, please. So um, a lot of conditions are going to want to see documentation of the condition, but then they want to see severity and impact as displayed through diminished mental residual functional capacity. So this is what we see with autism, for example. So we're going to show a psychological evaluation. Look, on the autism rating scale, it shows level 2 requiring significant supports. Okay, check that box. But then how does it really impact them? You would think that that would be enough, right? That level 2, that it's implied mental residual functional capacity standards, but no, not so much. So we kind of have to spell it out for them. And that's where they look for additional documentation. Do you have any IEPs? Do you have any letters? What do you have? And I'm careful about IEPs because IEPs are frequently very strengths based. I look at my guy and I have all these documents. Eric is a delightful child. I'm like, yeah, he's delightful some of the time, but let's talk about those moments when he's not so delightful and what his needs are, right? So these are the 4 elements that you bear the burden of proof to demonstrate the impact. It's understanding, processing, and memory, which is going to be tied to cognitive function. So you can say, look, we've got a full scale IQ of 76. This is a borderline IQ. I get that it's not an intellectual disability per se, but it's a borderline IQ. This impacts understanding, processing, and memory. Concentration, persistence, and pace. This is where we talk about co-occurring conditions like ADHD. If you have attention deficit disorder, that's a clinical diagnosis that shows that you have difficulty concentrating and staying on task. Other documentation or statements related to persistence, meaning how does this individual respond when they're doing some problem solving and they come across an obstacle? Are they going to persist and push through that obstacle, or are they going to lose some emotional regulation and either shut down or become upset? What does that look like? So you want to document those sorts of things as persistence. Pace. Does your individual work at a much faster pace because they're just trying to get the job done so they can move on to a preferred task? Do they work at a much slower pace? So you want to be able to document these types of behaviors because it lends itself to demonstrating the severity and impact of concentration, persistence, and pace. Social interaction, we want to talk about any challenges that the individual has with initiating and developing and maintaining relationships. This is where language deficits can come into play. This is where having explosive behaviors that can disrupt social relationships can come into play. So we want to be documenting that. And adaptability. So adaptability is generally looking at how this individual performs under stress, how this individual performs when their routine changes, how well can they go with the flow. And so if we have an individual who presents as highly rigid, we need a lot of structure, we need a high level of routine, and absent that, they're really going to struggle and experience emotional dysregulation. Well, we want to document that because that's going to show that there are significantly or significant limitations to that adaptability. So the standard that they're looking for under mental residual functional capacity is significant limitations in one or moderate limitations in two of those four areas. And I try to show two significant areas and at least three more moderate areas so that we're providing documentation that's over their standards. What is serious and persistent condition? This is applied for individuals who have a primary condition of that's a mental health diagnosis. So if my primary diagnosis is bipolar 2, what they're going to look at is, okay, let's see that documentation of that diagnosis. Got it. Now let's look at diminished mental residual functional capacity or documentation that the condition is serious and persistent. So this is where it's not an and, it's an or. Very, very important difference there. And sometimes that serious and persistent condition threshold is easier to demonstrate than the mental residual functional capacity one. So you would want to secure letters from the psychiatrist. This condition has lasted, more than 2 years. And even though we have medication intervention regimen and we have had these therapies to promote emotional regulation, we still are experiencing lapses, and this condition is serious and persistent. So you basically want documentation to that effect. Next slide. So again, how do they go through this process of making that determination? So primarily what they're looking at is what they have in front of them. The adjudicator is never going to call you to say, hey, let's have a conversation and get more information. They're simply going to look at the application that's presented. And again, where people go sideways is because they're not taking the initiative to provide their own documentation, right? So if people just sign the release and kind of walk away, it's not only going to take much longer, you have a less chance of getting an award on that first go because there's not enough medical documentation. You don't control what the doctors are sending them. So you're basically surrendering your control and narrative by not forwarding that documentation to Social Security. It's a really, really important piece. And that documentation needs to help them check the box of diminished mental residual functional capacity or that the condition is serious and persistent. Next slide. What happens if you lose? Don't give up, okay? So only 35% of applications are won at the initial level. BDI's rate's 70% because mostly we're being purposeful about providing what documentation that we're sending with. So we do have a much higher rate of approval there. But what do you do if you lose? You appeal. The thing about the appeal is you got 60 days, right? So you want to make sure that you are returning that documentation in a timely manner. There are two things that you have to send back. You have to send a request for reconsideration, which is a one-page form through Social Security that's basically saying, yeah, wrong decision. Why? Because we have documentation that shows the severity and impact of this condition. And you have to complete a disability report appeal. You can actually submit those documents online. Some key difference when you're doing the initial application, there's no opportunity to upload any documents. You're just completing the application and sending it, and then you get that packet back, you sign it, sign the release, send the medical documentation through snail mail. With the appeal, you can actually upload these documents. I strongly, strongly encourage you, if you're at this reconsideration level, that you have new medical documentation to add, because really all they're doing is they're picking up your file from desk number 1 and they're moving it over to desk number 2. So the likelihood of desk number 2 coming to a different conclusion than desk number 1 is really small unless you've added new medical documentation, right? So strongly, strongly do that. If you lose again and you're at the second level, persist. That's when you go to a hearing. And this is where you hear sometimes that the process takes, it took me 2 years. It's because they lost at the initial application, they lost at the reconsideration, and then they finally were awarded at the hearing. Next slide. If you win, yay. If you win, because it's been several months since you've had that medical screen, the first thing that's going to happen is they're going to do that medical screen over again. They want to make sure that in the 8 months or longer that it's taken to get that determination that your child did not win the lottery, um, that they don't have a job whereby they're earning more than the award. They need to make sure that that person is still eligible, both from an income stance and still doing that same resource cap of $2,000. So generally, they do that technical screen, and then that's when you should receive a notice of award. Curiously, you receive the money first. It's like um, how people find out is, oh wow, look, the money hit the account that we set up. Yay. And then the notice of award follows. Keep that notice of award. It's a very important document when your kid turns 26 and you want to keep them on your private insurance. Having that letter of award can be a great document that you give to HR and that process to help continue eligibility past the age of 26. Um, yeah, so that's really important. Um, what you would notice, I mentioned that the maximum award is 914, right? If they're living at home with you, then you're subsidizing them. You're providing some maintenance for them. So they're going that award, go, wait a minute, this is only $607. What happened? And it's because Social Security has lopped off 1/3 of the award. So how you cure that is through having a room and board agreement so that you can document and demonstrate to Social Security that your child, even though they live with you, they are paying their fair share, okay, of household expenses and all, including like, the mortgage and whatever, food, utilities, that they're paying their fair share. So they're not being subsidized. And so you send that agreement and then you show proof. You need to show that that individual has actually made payment, and then that's going to increase the award to that maximum of 914. Next slide. Um, so if you're working as a Social Security beneficiary, and I have a whole other presentation that's dedicated to this, so I'm just going to do a very, very high level overview. If you want the details, please come to that session. Working as a Social Security beneficiary, people ask, does it impact my benefits? Heck yeah, it does. And it does it in two ways. If you have SSI, it's a monthly calculation. So we would look at impairment related work expenses. We want to make sure that we're reporting each month. There's a lot of rules that you need to follow as it relates to working as a Social Security beneficiary. If you have SSDI, and you're working, you still have to report those earnings. At that point though, it's more of an all or nothing situation where you're entering a trial work phase during that 9 months that you have at working at the trial work level. Um, that you can earn as much as you can and it's not going to impact your benefits. Following that, you go into the extended period of eligibility, it's going to impact your benefits. It's going to be an all or nothing. If you're earning above substantial gainful activity level, then you're not eligible for an SSDI check. And again, this is where individuals get into overpayment situations because they're not reporting their earnings. And they are receiving Social Security, but they're also earning over substantial gainful activity. And then Social Security does a look back and go, oh, look, you owe $50,000 back. So you want to know all of these rules so that you can be prepared and minimize those risks. The Social Security Red Book, you can, again, Blue Book is all things tied to medical determination of disability. Red Book are all the rules. What are these impairment related work expenses? what is a pass? What's a plan to achieve self-sufficiency? So there's all these rules and regulations and pretty cool incentives that are outlined in the Red Book. And again, we do have a separate session just on this topic. Next slide, please. Definitely would encourage you to have a benefits navigator, a WIPA benefits counselor. This is determined by area, and all referrals are taken through the Ticket to Work helpline. So we have 3 different providers in Georgia. BDI has a WIPA program serving 54 counties, and again, we accept referrals through the Ticket to Work helpline 866-968-7842. Next slide, please. How does BDI help? So primarily we're helping on the acquisition side with that medical determination of disability. So I have an assessment that I utilize that helps to demonstrate the severity and impact, and trying to do Social Security's job, make it a little easier for them, give them the boxes. We've already checked all the boxes. This is the moderate to significant limitations in understanding, processing, and memory, that sort of thing. So, at the end of this 2-hour clinical interview that we do with you as the care provider, not with the individual, you're going to have good documentation about the severity and impact. It's going to be about 13 pages worth of good documentation there. So that is a great tool to add with your current medical documentation that sends off to the initial application. If you lose, I have a separate assessment that's specifically tied to diminished mental residual functional capacity. So it's basically, it starts with that checkbox. We do a case referral, we do a summary of activities of daily living, and then we're doing a deep dive qualitative overview of impact of those 4 areas. So it's a pretty good process. The national average for reconsideration is 12%. Ours is again 60 to 70%. So having that new documentation, really, really critical. For complex cases, I do a medical evidence review. Like if there's a bunch of documents and we don't trust the adjudicator to sort through it all, then we will sort through it all and prepare a summary and a chronology of the medical records to give to Social Security. We also help with overpayment issues. We have a whole other seminar just on that. And we're a WIPA provider. So BDI, we try to do a lot to help with the Social Security process. Next slide, please. This is just an overview of all of our programs. So you can access benefits navigation as just for benefits navigation as a standalone program, or if you are a family support services participant, then you can access benefits navigation internally. Next slide, please. And there we are. A lot of information. I can see your mind's blown. Let me know what questions you have. Let me go into the chat box and see what we got. If you're already receiving SSI without the room and board subsidy, how do you file an appeal to add it? So what you're basically doing is you're reporting a significant change. Hi, Social Security, guess what? My loved one is no longer being subsidized. Here's their room and board agreement. And I love giving Social Security their own forms. It just tickles me because it flummoxes them. There is a form that basically says if you are charging your loved one, let's say $600 for room and board. Question number 4 is the magic question. What's the amount that you would charge someone else? And you go, it's the same amount. And so it's using that form helps to show that you're not subsidizing them. So if you need help with this process, send me an email. I can send you that room and board agreement and that Social Security form so that you can get started with that process. Does substantial gainful activity only apply to SSDI or also SSI? It applies to both. So yes, if you're earning over substantial gainful activity and that amount is gross, 1,470. So if your loved one is earning $1,500 gross, they're over substantial gainful activity. And that means they're not viewed as disabled. So whether it's SSI or SSDI, if you're earning over that substantial gainful activity, you're at risk for losing that determination of disability. Let's see. Is the SGA still true if they have a ticket to work? Yes. Remember the goal of Ticket to Work. So Ticket to Work is a 6-year program. This is a work incentive if you're a Social Security beneficiary, and it's a quid pro quo in exchange for receiving some supports from, to help maintain the job, and in return for being shielded from a continuing disability review during this time, I'm going to eventually come off benefits. And the plan is that you would be at the substantial gainful activity level by year 3. My SSI is suspended until my son is 18. That will be in May. So when your child turns 18, you are going to apply for SSI on for them. So if they're receiving SSI through you as a minor, then when they turn 18, they can apply for SSI on their own right. This is interesting. So Social Security evaluated for SSDI, has worked steadily, earned enough credits. So, they're looking at being able to get SSDI, but through that process, she was denied SSDI eligibility, meaning that even though she has had SSI and at one point she had gone through that medical determination of disability, they're now looking at her again. And here's the thing is everybody is going to go through a continuing disability review. So once you've been determined disabled, that's not forever and ever, amen. It's a period of time, and most times it's 3 to 5 years, sometimes it's 5 to 7 years. Um, the last one, I can be kind of snarky with Social Security because my son's level of impairment is pretty significant, so he is not borderline. So when they call me and we're doing the continuing disability review, I can say things like, yeah, nobody's cured autism since the last time, so here we are. I get to say stuff like that. When you're borderline, it's tough. And when the individual is working, especially if they are working close or at or around that substantial gainful activity level, you're walking on thin ice. Okay, so what do you need to do? What you need to do is show that, okay, yeah, she's working, but take a look at the special considerations and the special conditions that allow her to work. Look at all of these accommodations. Look at the fact that she has a job coach. Look at the fact that voc rehab has established her as a priority one. Look at the fact that she's on the DBHDD planning list and is participating in competitive employment integration. So what you're trying to do is kind of toggle back and forth to show that these other agencies have made a similar determination of disability, and so should you, right? One of the key pieces of documentation is that individual's eligibility for a now comp waiver. So if you have that letter from the DBHD that says, yeah, this person has been predetermined eligible and they're on the planning list, they don't have a waiver yet, but they're on the planning list, send that letter as part of the documentation of the severity and impact. You can also use a DMA-6. So a DMA-6, if you're awarded a now comp waiver, one of the first things that you have to get is a DMA-6. This is a form that the doctor signs that's basically saying that this individual's conditions are so severe that they warrant that eligibility for an intermediate care facility. The whole point of a now comp waiver is we don't want our loved ones in a care facility. We want them in the community. And we're waiving our eligibility for that because we want services in the community. We want a home and community based waiver, not an institutional setting. But that DMA-6 is the physician attesting that they meet that level of care. So send that DMA-6 to Social Security as clear documentation of that individual's severity and impact of their condition. If you have guardianship, that letter of guardianship, awesome documentation to give to Social Security. So it sounds like in that situation, it triggered another medical determination, and they may not have had enough information to get to that proper determination. Let's see. Um, Okay, so this is a interesting one. You have an individual with Down syndrome. So we know she's medically eligible. She had Katie Beckett. They're not looking at income, so her condition's pretty significant. But she was denied SSI because of that technical requirement. Remember, it's needs based, and child support is attached to the person. So if the child support is of a certain amount, then the individual is not eligible for SSI. So the only way to cure that is to modify the separation agreement to have the child support go into a first party special needs trust. And then that's going to make her technically and financially eligible for SSI. Um, let's see. There's a lot of questions in here. Sorry. All right. So there's the question of applied for SSI, received a denial because she didn't pay into the program. Yeah, that's SSDI. So it's okay. Um, just file 13 that letter. It's going to be fine. You don't need to start the process over again. Her SSI application should still be pending. One of the things that happens, and it takes a while because again, they're really super understaffed. That case is going to go to Disability Determination Services. And they usually send you a letter, and it's basically saying, "Hi, I'm the case manager, and your case is in adjudication, and I may have more information." And then their phone number and their name, and it's like the first initial and their last name is in tiny, tiny little print, near the bottom of the letter. But that helps you know, okay, it's in the process. It's been assigned to an adjudicator for review. And so we have some folks who are bogged down that their case hasn't been assigned to an adjudicator yet. All right, I'm going to take one more question, and then I think we're going to wrap up because we're pretty much at our time. Um, what happens if the parent applies for disability benefits and the child receives the Social Security income benefit? That's that transition point. So let's use my son as an example. So he's 30 years old. He's got SSI starting at age 18. Both of his parents are still living. Both of his parents are still working. Neither of his parents are disabled. So right now he's not eligible for SSDI because he hasn't earned enough work credits on his own, even though BDI now has hired him. Yay! But still hasn't earned enough work credits to be considered for SSDI. When I retire and I apply for Social Security and they're going to ask, do you have an adult dependent child? I say yes. And at that point, his file is going to transition from SSI to SSDI, but he's going to be able to maintain his Medicaid as a childhood disability beneficiary. I hope that helps. If y'all have other questions, my email is Anna, A-N-N-A, .Maki@BobbyDodd.org. We have a lot of other sessions coming up. I have a special session on handling overpayments. I really would like y'all to participate in that. If your loved one is working, you do not want to get an overpayment situation. You do not. So let's go through how you prevent that from happening in the first place. And if it's happened, how do you cure it? So we'll have a session on that. We have a session coming up about special needs trust. Y'all, if y'all are doing long-term life care planning, we really need to have that set up. So we want to have a session on that. And then I have another session coming up that's working as a Social Security beneficiary. That's when I'm doing a deep dive into all these work incentives. So I hope this has been really helpful for you today. Thank you so much. I appreciate your time. Looking forward to help you. Remember, BDI is here to help. So if you have any questions or if you want some assistance walking you through that process, this is something that we can do with you. Thank you.